So when you're treating somebody with this condition, who are you treating?
You spend a lot of time early on doing what we call mapping the system. You're getting to know which are the key alters.
Because they're called alters.
Yes, technically we call them alters. And it's very important to get to know who does what, and because they all have a role. And so as a therapist, your job is to work out, what their role is, because then you can understand, why they're there and what they're going to be concerned about. And then one of the important questions I ask each of them is, what is your trauma awareness? And some of them have no awareness of trauma at all. They have no idea that anybody was traumatised. And that allows them to go out and function. And then you have the ones who are holding the trauma. A metaphor that I use with these patients a bit is that they've got a nursery full of these very young, child parts that is staffed by warriors who are all outwards facing. They're very protected. And their skills, particularly as they become adults, you do not screw with these people, right? They have the capacity to defend themselves very strongly. So you've got these young child parts that are living in this space where nobody has told them the war's over, and because the system is built for protection and safety, they often don't have parts that are very good at caring for those young parts. So what you're doing as a therapist is you're letting those young parts know that not only is the war over, but there are people now who actually do care about their welfare. And the best way to do that is you mobilise parts of the person, more mature alters, to actually become parent figures to those young exiles.
How does it come about, though? I guess we're talking about an extreme version of our brains. When does it kick in?
Yeah. Well, this goes to the heart of the condition, because we can all dissociate if we're subjected to sufficient distress. But for most of us, that capacity requires an enormous traumatic experience to make you do this once our brain is more mature. But the younger we are, the easier it is to dissociate off parts of your mind. So children who are subjected to significant traumas prior to the age of 8, and the younger you go, probably the easier it is, they are able to split off parts of their mind in this way.
So you're saving yourself.
Absolutely. Their mind is just coming up with an incredibly sophisticated, clever solution to a scenario that most of us could not begin to understand or relate to.
Hello, I'm Liz Hayes. Thanks for watching. To keep up with the latest from 60 Minutes Australia, make sure you subscribe to our channel. You can also download the 9Now app for full episodes and other exclusive 60 Minutes content.